know what she said. She might just change your life.
Kate Wheeler and Sharon Caddy in studio, welcoming now our guest Anaida Deti, CEO of Dental X Centers and registered dental hygienist. Welcome.
Thank you.
And we have you here. It is Breast Cancer Awareness Month, and we're going to talk about the relationship between dental and gum health. This is something that maybe not from a cancer perspective, but I never gave it much thought until I had a hip replacement surgery. And ever since then, I have to take a course of antibiotics before I go for any kind of dental procedure. It's amazing how connected our dental health is to other functions in our body, right?
Absolutely. We usually say there is no healthy body without a healthy mouth. So it is very important. It's like the opening of the body. So it's important to have a healthy mouth, especially during and cancer treatment.
So how would if you weren't attending to it properly, how could it be impacted? How could your course of treatment be impacting your health without taking good care of your teeth?
It's the first thing that usually when people go for cancer treatment, the first thing they usually say is to see the dental hygienist or the dentist to make sure that they have a healthy mouth. It's important to have a thorough cleaning usually before, and also to take care of any pre-existing problems that they might have in the mouth. Usually the side effects that you see during cancer treatment is usually sore mouth, it's bleeding gums, infection that you might see, and also sores in the mouth. So probably the first thing is to book an appointment with a dental hygienist and the dentist that usually you can see all these problems, and after just to make sure that everything has been taken care of before the radiation or the chemotherapy treatment.
Okay. And then during the course of treatment, depending on how long it is, for some people it can go on for quite some time. Is it advisable to constantly be visiting a dental hygienist throughout, or is it kind of you go back afterward?
No, absolutely. You have to see the dental professional during your chemotherapy or radiation, and we usually at Dental X, we try to see our cancer patients for every 3 months to make sure that they are taking good care of their teeth, and if it's anything arising during that period of time.
Does a dental hygienist often work with or connect with the oncologist to talk about things?
Absolutely. It is very important to have a relationship with the oncologist of the patients, just to make sure that you can get the patients comfortable during the treatment and see if they have any problems during that time that you can prevent it.
So are there specific medications or things that you can do that can help reduce the possibility of mouth sores and that kind of thing?
Absolutely. There is medication. They are usually prescribed by the doctor or the dentist, and it's very good that those medications are prescribed to the patient to make sure that they ease their treatment. And also you can use Tylenol and other pain medications just to make sure that it helps them a little bit.
And during the course of treatment, is there greater chance, because you're saying there's soreness, greater chance of bleeding, flossing, brushing, will that not aggravate? Like how does a cancer patient going through these treatments take good care of their oral hygiene on a day-to-day basis?
It is very hard for a patient going through cancer treatment. They are going, as everybody can imagine, they go through a lot of emotionally, physically, psychologically. So usually their oral health is the last thing that they think of. But it is very, very important for them to take good care of their oral health, and they have to have a certain routine. So if they can, it's good to brush at least twice a day, flossing at least once daily, and just use fluoridated toothpaste for them just to help a little bit. Most of the time I see quite some patients that are cancer patients, and they usually have a very dry mouth, so I usually suggest them we have some some kind of toothpaste or mouth rinses that usually help with dry mouth. That is very common during
and
cancer
that can
treatment.
be something that it affects other people as well, especially if you're using any kind of medications, even
Absolutely.
with other, whether it's chronic conditions or illnesses. Dry mouth can be a real problem.
Absolutely, it is a big problem because saliva is usually the best, like it's the best treatment you can have in your mouth. So if there is no saliva and there is dry mouth, usually it affects your gums, it affects your teeth, and usually it's usually good to take good care so you can prevent the dry mouth.
I want to tell. I know we've had you on before, but I want to let our listeners know a little bit about your background, because you're like the great Canadian dream.
You are.
You're the great story. You emigrated from Albania 10 years ago with your husband.
Yes.
With $500 in your pocket and a dream.
Yes.
Right? So you dreamed of opening your own business. So 7-day work weeks, a diploma, and 7 years later, you open the doors to your own dental hygiene practice, the Dental X Smile Centers. Now it's Dental X. But you've made it your mission to educate patients on the importance of dental health, but you've also, you give back, and this is what we see so much from people that come here, because tell our listeners what Mission Kind does.
So what I have done is that I usually offer, I started as once every few months to offer 1 day for kids that cannot afford dental care, to offer completely free dental care, including cleanings, x-rays, exams, fillings, or whatever those kids might need. So like right now, because I have a small baby, so unfortunately I cannot do it every few months. I'm starting to do it every 5-6 months until the baby grows up a little bit, and I will definitely start probably, I'm thinking next year, I want to do it once every month.
It's so important because it's one of those things that dental care is not inexpensive, and unfortunately, if income is below a certain level, sometimes if you're going to be letting things go on, people let dental care go.
Absolutely.
And it's so important not to, especially with our young children as they're growing through their stages.
Absolutely, it is very important. What we usually find at Dental X, I see a lot of mostly teens, and they usually, I find that they need mostly help with their dental care and oral health care. It's because that's the time when the parents usually don't take care of their teeth anymore, so it's their responsibility to take care of their teeth. So we usually suggest the parents, when they have teens, to have them bring to the dental office usually every 3 to 4 months, to make sure that they are doing a proper job cleaning their teeth, and also if there is any problems to take care right away.
We are speaking with Anaida Deti, the CEO of Dental X Centers, and you are listening on What She Said, SiriusXM 167. You brought up children, and something happens at the end of this month that I think drives a lot of dentists crazy. Let's talk about how we can manage all those Halloween sweets on the teeth. Do you have rules, suggestions?
Absolutely. Usually, I'm very lucky. I don't like sweets very much. The same with my
Okay,
family.
we don't like you anymore.
So the thing is that for me it's quite easy. So when I say to our patients, do this and do that, it's usually not as easy for them to do as it is with me. So I try to give them little tips that might help them a little bit. So usually the first thing I say to them is go through those candies and make sure that you remove all those sticky candies that
The chewy ones.
Yes.
Exactly. So those ones that stick in your teeth and they make it very hard to remove, and they will cause cavities, and that's not so good. So usually that's the first thing what I tell them. After, I usually say to parents just to give the kids probably a few candies at a time, just to make sure that they just take a few of them. And
you really only have a baby, don't you?
Yes.
That just doesn't
no,
happen.
I also have an 11-year-old.
You have an 11-year-old?
But he's just like me. He doesn't like candies, so we are lucky that way. So I usually say just give them a few at a time. They also will last longer, and it will be good for their oral health. Also, what I usually suggest is to give a lot of healthy snacks. So usually the best ones are the pre-cut fruits and vegetables. Usually the pita, hummus stuff, or usually if it's like nuts usually are great for teeth. Probably also the dairy products, they are great for the teeth. Usually after they have candies, if you give them a piece of hard cheese, that will usually help that will help the teeth, and it will just produce a lot of saliva to make sure that it cleans that sugar away from the teeth. So those are usually, little tips. That's the most important thing for the kids. It's not just for Halloween. It's always during every day. It's to have them brush before they go to bed.
And so basically the candy is not the last thing before bed. It's the brushing is the last thing
Exactly.
before bed.
Also, it's important to bring them to the dental office to see the hygienist or the dentist for their usual checkup and cleanings. Even though they are young and small, they still have to see the dental professional at least every 6 months to make sure that they are doing good.
Mm-hmm. Seeing a dental hygienist on a regular basis is great. How
Absolutely.
often, though, do you need to bring the dentist into the circle?
Usually, what we do at DentalX, what we usually see is we see the patient, and after we see the patient, we decide that if they need to see the dentist or not. But what we usually do is at least to see the dentist once a year, just to make sure that everything is good, and if they need any x-rays or anything that the dentist will have to do, it's usually a good idea.
I love this idea, though, because just coming in because most of the time you go to the dentist, you end up with the dental hygienist.
Absolutely.
So the cleaning and the proper education about dental
Exactly.
hygiene is the most important aspect, and you're
Exactly.
taking care of that so well.
Exactly. We usually at DentalX we try to focus a lot on prevention. That's usually the best thing, in education for the patient. And our appointments are no less than an hour, just to make sure that they get all the information, all the treatment the best way possible.
And as a mom, I'm sure you are really great at making sure the kids are having a positive experience in a dental environment.
Absolutely.
Because honestly, I look back when, I don't know about you, Kate, but when I was little, my dentist was the scariest person in the whole world. And I mean, by the time, this was a problem, though, because you get to your teenage years, and my attitude was, I don't have to go there anymore because
Exactly.
they're scary. And then when I finally got back into a regular dental routine, I remember I went to a dentist and said, okay, I'm here because my tooth hurts.
Exactly.
If you scare me, I am never coming back.
Exactly. And that's what used to be the dental the dental experience used to be a scary experience.
Yeah.
But right now
It
it's
doesn't
not.
need to be.
Absolutely, it's not. When we see the kids coming in, usually they are my favorite patients because they come in, they are all happy, they know they will have a pleasant experience, and they know when before they go they will have a little toy to take with them. So it's not anymore a scary experience, but it's actually a very pleasant, and they look forward to their
That's
next
important.
appointment. Absolutely.
Well, thank you very much for telling us about everything. It's fascinating. I never thought about the connection between your oral health and treatments for cancer, and with it being Breast Cancer Awareness Month combined with Dental Hygiene Month. That's a good connection, and thank you very much for telling us all about it.
Thank you very much for having me.
Click the channel subscribe button for full-length interviews and more from What She Said here on YouTube.